Look younger, feel better. Medical Spa of Midland.
Welcome to Medical Spa of Midland. Today we're going to be discussing the HCG weight loss protocol. HCG stands for human chorionic gonadotrophin. It's one of the hormones that your body produces during pregnancy. No one really knows how HCG works. It works in combination with the very low calorie diet. The very low calorie diet, meaning 500 calories, actually brings the weight loss. The HCG, it is believed the HCG actually gives you emotional stability, makes you not as grumpy, and that's why it works together so well. The 500 calorie day restriction comes from the original protocol from Dr. Simeons. He was an endocrinologist who did a lot of research and actually helped develop one of the first medications for malaria. He also developed some lab techniques that I understand are still in use today. The 500 calories that he initially used was in an inpatient, very controlled surrounding. Some physicians will raise that calorie intake to even to up to 1,200 calories per day. You will still lose weight on 1,200 calories per day, but not as rapidly as the 500 calories. It's only for 6 weeks. So if you have 15 pounds or more to lose, which is the suggestion, if you have less than 15 pounds to lose, this is probably not the program for you. But if you have that much to lose, then probably you will not suffer any ill effects from that very low calorie diet for that short period of time. Men can go on the HCG diet. It's actually beneficial for men as well as women, and the original testing was done on men in India. Dr. Simeons was working in a hospital in Rome, and there was a large group of Indian young boys, and they had very, very feminine physical features. So these men, they were called the fat boys, and these fat boys had breasts like a maiden. I mean, they had severe gynecomastia, and then their genitalia was very small. So the HCG, the way it works with testosterone, is what brought about the changes. So he was an endocrinologist, and he didn't have complete understanding. We still don't have complete understanding, but he knew enough to know there was a relationship, and it worked. These guys went on to live a normal life, but they were kept in the hospital under controlled situation, a controlled environment, and they had great results. And that's how the protocol came about. No one really knows how HCG works. There are studies that show it doesn't work and studies that show that it does work. There are many, many people who will tell you it does work. As with any weight loss protocol, if you go back to your old ways, you will gain weight. It's believed that HCG works on the hypothalamus in some way. It's unclear. As I said, the studies don't show clearly that it's successful or not successful. The way that it is believed to work is against the fat. You have different types of fat. You have old fat and not so old fat and new fat. The new fat would be the fat you would acquire when you're eating on those loading days. You eat pretty much nonstop and you don't do a whole lot, so you're going to gain some weight. It may not show up too much on the scales, but your body, if you're not using those calories, it will be weight. So the weight that you have had since childhood is a different type of fat. Its chemical makeup is different. Its physical structure is different. The weight that you gain say after you have a child and you don't lose weight, that weight is different than the weight that you gain from eating too much over the weekend. They're different types of fat, and the HCG is thought to work with those types of fats to release the nutrients within the fat cells to make your body metabolize the fat more easily. But it's not understood. Initially, most people feel hungry. You're starting a very low calorie. It's almost like a fast. Well, let me back up. Your very first couple of days, you have loading days, and you eat like a pig, an embarrassing amount of food. And then on the third day, you go to your very low calorie diet. There's reasons for that. It's kind of like putting gas in your tank. The HCG helps burn different types of fat. So you want that quick energy, that kind of fat that's stored from what you've just eaten in the last few days is different than the fat that you've been carrying around since, childhood or however long, for years. So you need that little boost of fat there. When you start that 500 calories though, it's like starting any diet. It's kind of hard. After a day or two, your body gets used to it and you're rocking along pretty well. You're also motivated by seeing 1 pound, 2 pounds gone every day. The first week, it's not unusual to lose anywhere from 4 to 7 pounds, and some people even more. It depends on how much you eat initially and how strict you are with the protocol. Men usually lose on average 1.5 pounds. Women lose on average 1 pound per day. So that's quite motivating. But after that first week, you feel fine, your energy level is fine. Everyone's a little different, so it's hard to say exactly how any individual would do, but for the most part, after the first day or two, you're rocking along fine. The HCG weight loss protocol is just that. It's a protocol. It has a beginning, it has an end. The only reason to take it, to start on this protocol, is to lose weight. You may need to lose weight for a procedure, a surgical procedure, or an event such as a reunion or a wedding, or just for general health. It's not a diet you're going to be on forever. It's not a weight loss lifestyle change. You cannot live your life on this diet. It's a 6-week protocol. It has a beginning and an end. You can repeat it, but it will be repeating the protocol. It's not changing your life per se. You are more likely to become pregnant if you're on the HCG diet because you're giving HCG. HCG is the medication that is given for infertility. The doses that are given on this protocol are much less than the doses given for infertility. We require a pregnancy test for this reason. We require a pregnancy test before you start the protocol. If you become pregnant while you're on this protocol, you need to stop your very low calorie diet, stop the HCG, and of course go see your obstetrician. Your menstrual cycles probably won't change much, if at all. The dosage of HCG is very minute. It's not the same as what you would give for infertility. So it most likely will not change your menstrual cycles. Anytime you lose weight quickly or lose a lot of weight, your skin may not be able to keep up with the shrinkage. It depends on how long you've been overweight, how overweight you are, or what your age is. If you're 65 and you've been 50 pounds overweight for the last 30 years, your skin is not going to shrink back very quickly. If you're 35 and you're trying to lose that baby fat, you know, the fat that you got when you were pregnant, then yeah, your skin is going to shrink back. So if you lose 15, 20 pounds in a month's time, your body's probably going to go back down. But if you're in your 50s or 60s and you're losing 30, 40 pounds over a 2-month period, depending on if you repeat the protocol, then yeah, your skin's not going to just spring back into shape. It's going to be stretchy and saggy, but you will look better overall because you'll be healthier because you lost weight, and you'll feel better because your clothes fit better, or you had to go buy new ones. HCG will not work without the diet. What it does is make you feel better. It helps you relax and you're not as emotional. The weight loss comes from the diet. Any calorie restriction below what you normally eat is going to make you lose weight. So if you usually eat 2,000 calories a day, you drop it down to 1,500, you're going to lose weight. If you usually eat 2,000 calories per day, you drop it down to 500, you're going to lose weight, but you're not going to be fun to live with. So the HCG is believed to make you nicer. The HCG weight loss protocol should not interfere with any of your other medications. The HCG is a naturally occurring hormone. You take it sublingually, so it's not going to be absorbed by your stomach, so it shouldn't interfere. It should be fine to take with any medications. Unlike some places, we require some baseline lab work. We want to rule out hypothyroidism and diabetes specifically. So we require some lab work. You don't have to have it drawn here, but you have to have it within 30 days. For most people, it's more convenient to have it drawn here. It's part of the program cost. And we've actually found some people who needed to be treated medically before they could start this program. You get your diabetes in control, you get your thyroid under control, and then you can start this program.
Look younger, feel better. Medical Spa